My name is Reverend Dr. Kanga. I'm the regional chair for the National Council of Churches in this region. I was chairing this session that has been taking place today in Limuru. School boards to change their strategies, how they operate, how they allocate money, to make sure that the first and priority in the priority in those allocations should be about food. In county committees, board of management of schools, be it primary, lower primary, those who are in junior high school, we organize ourselves well so that we make sure that a priority becomes our children. That we call upon the government to provide or release this money early enough to take care of our children and especially meals, and increase the area of food, the money meant for food, so that the children will be able to feed and we take care of them as early as possible. Because an hungry child is always an angry child, and a child will not know why he's feeling the way he's feeling. So money should be released early enough, and it should be added. We should add enough, we should add more, higher. And then about the same thing will also affect the population. Because the population of children, when there are so many in a school, you also need to think about that population, make arrangements for that population, be able to deal with the population as they are, so that you don't provide little food for many children at the same time. So you need to add mugao ya watoto. It must be given as per what they are in those schools. Health meals in schools, we are deeply dismayed that learners in schools are not served nutritionally balanced food at every meal. The reasons for this state of affairs include high cost of foodstuffs, weak implementation of existing laws and guidelines on nutrition, and ignorance-driven attitude that focuses on filling the stomach rather than nutritional value. Cultural practices and beliefs also affect the foods that are served to learners by schools. On its part, the government bears responsibility, since the capitation for students does not include meals. Further to this, there is a glaring lack of system and structures to oversee procurement of foodstuffs for schools. It is notable that both in the boards of management and county education boards do not have a spelled-out mandate to oversight the food served in schools. The lack of quality control of foods procured for learners in schools is a great exposure that could spike the prevalence of NCDs among adolescents. And we call upon the government to make a deliberate decision to focus on the nutritional value of the meals served to learners in schools. The health of the learners should invite us much attention as the learner's presence in the school. Towards this, we urge that nutritionalists be appointed at the sub-county level with mandates to work with the schools to ensure that they serve food to learners that is healthy and relevant to socio-cultural settings. There may be need for collaboration between the ministries of health and education on this undertaking. We further urge that the government displays this concern for the welfare of the learners by expanding the school feeding programs to all schools. All schools. Children of Kenya are equal, and so this should be extended to all children in Kenya. I don't think there is any excuse, whether it's because the high cost of living has caused us to be where we are. In my opinion, each one of us has a responsibility with the little you have to make sure that our children get quality food. Whether we are poor or we have everything, high standard of living or without high standard of living, the little that is there, the medics will tell you it's about how you think and how you organize the little you have on the table.
David Makime, I'm the head teacher of Limuru Town Comprehensive School. It has been contributed in many schools because of the number of learners For sure, we are talking about the 100% transition, and for real, we have quite some congestion in quite a number of schools. And like here, the area of the welfare, and I think that is where feeding of learners falls on. We need to encourage the parents also strongly to come on board and ensure they are supporting the school management to think about this. And also wish to mention that the other stakeholders like local health centers, they should come on board at least to advise and to give us, because truly speaking, the parents and everybody is feeling the pinch, especially because of the economy. But we cannot, and I say again, we cannot assume the role of taking care of the welfare of the learners. Food commodities have also gone up. Actually, it's only that luckily some food items in the market have gone lower, but still we are finding that schools trying to manage the few resources, the few coins they have to buy the learners' food, sometimes it's becoming a bit difficult. So I think this is a discussion that we need to have. But let me say, the government also needs to come on board strongly. And as now we are talking about the junior school, we are talking of congestion because bearing in mind